Today I want to tell you about 3 mild laxatives. First, magnesium citrate. Magnesium is a vital element that is found in all the cells in our body. Magnesium acts as a cofactor in over 300 enzyme systems that regulate various biochemical reactions in our body. Magnesium plays an important role in the transport of calcium and sodium through the cell wall. Thus, it regulates the excitability of the smooth muscles of internal organs. The intestinal wall also has in its composition smooth muscles, so in magnesium deficiency is almost always constipation. In rare cases, on the contrary, liquid stools, but most often constipation. By the way, the desire to eat chocolate or other sweet foods can be caused by magnesium deficiency. Magnesium citrate is a good laxative. Depending on the patient's condition, I prescribe magnesium citrate in a dosage of 200 to 300 milligrams per day. Higher doses of magnesium in some patients can treat migraine-like headaches and reduce the severity of premenstrual pain in women. If the patient experiences irritability, nervousness, difficulty falling asleep, I prefer to prescribe magnesium glycinate. The most common form of magnesium in pharmacies is magnesium oxide, but magnesium in this form is less absorbed than citrate, glycinate, taurate, or other chelate forms, so the dosage of magnesium oxide may need to be increased. You should be careful with dosages and forms of magnesium because large amounts of magnesium can lead to calcium deficiency, a sharp drop in blood pressure, and even central nervous system suppression. This is a separate big topic. As a laxative, it is magnesium citrate in a dosage of 200-300 milligrams per day that helps perfectly. Sometimes in Russia, magnesium sulfate is used to eliminate acute constipation, to cleanse the intestines before medical manipulations, and in the therapeutic and preventive procedure called tubage. In the United States, magnesium sulfate is not sold without a prescription. Does your country sell magnesium sulfate powder without a prescription? Write in the comments below. I'm very interested in that. When taken orally, magnesium sulfate acts as a laxative. This form of magnesium is poorly absorbed in the intestines, no more than 20%. High osmotic pressure is created in the intestinal lumen and water accumulation occurs. As a consequence, the intestinal contents are liquefied. Peristalsis of intestine increases, that is the contraction of intestinal loops. Dosage of magnesium sulfate for adults from 10 to 25 grams one time a day on an empty stomach. The powder should be pre-dissolved in a glass of water, 200 milliliters. Be careful, magnesium sulfate has many contraindications: hypersensitivity, appendicitis, rectal bleeding, intestinal obstruction, acute inflammatory diseases of the gastrointestinal tract, dehydration, hypomagnesemia, pregnancy, breastfeeding, etc. In addition, magnesium sulfate can reduce the effect of various drugs, so take it only when prescribed by a doctor. Second, psyllium. Psyllium is known as ispagol, ispagula, or ispagula, or plantain seed husk. Warning: psyllium is not the plantain that grows along the roadside and whose leaves almost every Soviet child applied to wounds. The plantain family Plantagenaceae has more than 150 species, and in the territory of the former Soviet Union, there are about 30 species. The Soviets used to apply plantain, Plantago major, to wounds, and psyllium is the seed coat of the Plantago ovata plant, which grows mainly in India. A species of plantain, psyllium, is prescribed for the prevention and treatment of constipation. Decoction and mucilage from the seeds contain a special substance, glycoside occubine. Glycosides are organic substances of plants which, when broken down into sugar and non-sugar parts. Occubine, when hydrolyzed, breaks down into glucose and occubigenin, which activates intestinal peristalsis. In addition to occubine, psyllium contains a large amount of mucilaginous substances. The seeds and seed husks swell in the intestinal lumen, increase the volume of intestinal contents, and soften the fecal masses. And mucus facilitates their progression through the colon. Emptying of the intestine comes in 6 to 8 hours. Psyllium is available as capsules or powder for oral administration. The dose and frequency of use depend on the indication, the age of the patient, and the dosage form used. In general, psyllium is considered quite safe and has few side effects, but there are important points to be thought about. First, psyllium is highly hydrophilic. It quickly absorbs water and turns into a gel. What's more, psyllium can absorb water up to 20 times its weight, so it's important to drink plenty of fluids when taking it. Be sure to drink plenty of water, 8 ounces or 240 milliliters with psyllium, so it doesn't swell in your throat and cause choking. If you take psyllium with not enough water, you may experience increased gas formation, abdominal bloating, and may even experience intestinal obstruction and fecal stones, bezoars. Second, psyllium preparations do not always work immediately. Sometimes it takes 2-3 days before the effect appears. Third, psyllium is indicated in people with atonic constipation. Atonic constipation is constipation due to decreased tone of the intestinal wall and sluggish peristalsis of the colon. Such types of constipation are more common in sedentary lifestyle, in elderly patients, in the postoperative period, after infectious diseases, etc. There is another type of constipation, spastic constipation, in which spastic abdominal pain and sheep's stools are noted. In patients with spastic type of constipation, psyllium can worsen the course of constipation and increase abdominal pain, bloating, and gas formation. The differences between spastic constipation and atonic constipation are in my video about types of constipation, link in the description below. Psyllium is unlikely to help people with spastic constipation. Third, Cascara sagrada. Cascara sagrada or Joster portia, meaning sacred bark, is a natural laxative for constipation. Cascara sagrada should not be confused with cascara. Cascara is the dried skin of coffee beans, which some manufacturers use to make lattes and other coffee drinks. Cascara sagrada contains the active agents anthraquinone and hydroxyanthracene. Oh my gosh. These substances cause an increase in local peristalsis in the colon, improve blood supply to the intestinal wall, stimulate nerve endings. All this together has a loosening effect. The effect comes in 8 to 10 hours after taking it. Cascara sagrada, unlike psyllium, can be used both in atonic and spastic constipation. This drug is used to restore the tone of the colon and thus helps to overcome the dependence on laxatives in old age. Cascara sagrada is quite effective in cleansing the gastrointestinal tract, but unlike stronger laxatives such as senna, it has a mild effect on the GI tract and can be prescribed for hemorrhoids and rectal fissures. Cascara sagrada has diuretic effect and when taken together with other diuretics may increase the loss of potassium, sodium and chloride by the body. Cascara sagrada should also be used with caution with digoxin, warfarin, corticosteroids and certain other drugs. Cascara sagrada used to be approved by the FDA as an over-the-counter medication for the treatment of constipation, but this approval was rescinded in 2002 due to a lack of clinical studies. Today, Cascara sagrada is available as a dietary supplement but not as a medication. Despite the fact that you can buy all 3 of these laxatives in the pharmacy without a prescription, I do not recommend using them for constipation for longer than 7 days and without a doctor's prescription. Constipation certainly needs to be treated, but not always with medication. As a doctor with 14 years of experience, I warn you, before you run to the pharmacy for medicines, especially if you have chronic constipation, you should first find out the cause and type of your constipation. Change your diet and drinking regimen. Be examined and only then choose therapy together with your doctor. Medicines as well as enemas and suppositories should be used for acute constipation that occurs rarely. In chronic constipation, treatment should be complex. You will find the link with all the constipation videos in the description below. I wish you royal health, love and light. your Dr. Zarifa Romanova.